Hashimoto's thyroiditis. The thyroid gland is located in the anterior of the neck, with the larynx and trachea accompanying the gland. It is the largest endocrine gland, and with the hormones it produces, supports the body's metabolism and protein synthesis. Hashimoto's thyroiditis is an autoimmune disease that affects the production of thyroid hormones. The thyroid gland is the main organ that helps the body to metabolize. The release of thyroid hormones is signaled from the hypothalamus, located in the brain, as seen on screen. The hypothalamus reacts to the low level of thyroid hormones and instigates the release of thyrotropin-releasing hormone, or TRH. This then binds to the cells within the anterior pituitary gland, causing the release of thyroid-stimulating hormone, or TSH. TSH is then transported into the body's circulation and binds to TSH receptors on the membrane of thyroid follicular cells. Following the signal from the hypothalamus, the thyroid hormones begin the production of thyroid hormones. In normal thyroid hormone production, thyroxine, or T4, and triiodithyronine, T3, are produced from the thyroid gland, which are infused into the thyroglobulin. This is where hormones are then stored and prepared for transportation. Iodide is associated with the transportation of sodium, which is moved through a transmembrane protein, which can be found in the membrane of thyroid follicular cells. To then release the T3 and T4, thyroglobulin is reabsorbed back into the thyroid follicular cells and bound to amino acids, then converting the T4 to T3, which then leads to the synthesized hormones being released into the body's extracellular fluid and into the body's circulation to be implemented where needed within the body. In Hashimoto's disease, the body creates autoantibodies that it then produces to attack thyroglobulin and TSH receptors. This can lead to cell-mediated damage, which can eventually lead to the death of the cells, which is known as cytotoxicity. Within the body, there are T lymphocytes and helper T lymphocyte cells, which in Hashimoto's is the cell-mediated autoimmune response, which are then activated. When these convert into a cytotoxic cell, this then leads to the process of eliminating thyroid follicular cells. In patients who present with Hashimoto's disease, the levels of their thyroid-stimulating hormone, TSH, is high. Free thyroxine, also known as FT4, levels are low, and their antithyroid peroxidase, also known as anti-TPO, levels are increased. When these serum levels are tested, an indication of Hashimoto's, there is a significantly elevated or present anti-TPO antibody. This is how a majority of patients are diagnosed with the disease, as these levels are evident that there are autoimmune cells present. Levothyroxine is a medication that is thyroxine, which is also known as T4, and it is a hormone produced from the pituitary gland. Levothyroxine is also under the class of thyroid hormones. It is indicated for hypothyroidism and for treatment and prevention of goiter. When levothyroxine is taken orally, it then becomes absorbed and transported from the gastrointestinal tract, or the GIT. It is transported into the body's circulation by binding to thyroglobulin from the GIT to the liver and kidney. T4 is then converted back to T3 and then bound to deionized metabolites, which then become excreted and broken down into bile and urine. Nursing considerations for levothyroxine include if patients exhibit hyperthyroidism, to stop intake for 1 week and restart at a reduced dosage. If changing branding, to monitor their thyroid function and adjust accordingly. Other considerations can include patients with diabetes mellitus, adrenocortical or pituitary insufficiency, cardiac history, and malabsorption issues. Pharmacological therapy is used to re-establish euthyroid, causes the patient to take levothyroxine for a lifetime period. Thus, once euthyroid is reached, it is about maintaining that state, and the dosage of medication may need to be reviewed and lowered by the doctor or GP. Levothyroxine is used in TSH levels, which means that the thyroid hormone levels need to be monitored regularly, as if TSH levels become high, the patient can start exhibiting hyperthyroidism and more dysregulated thyroid hormone balance. A risk for this is also that patients may self-dose, as they don't view it as a high enough dosage, as they may experience things like weight gain and other symptoms.